Hello, my name is Kkubeja. Today we are going to work on the neck and thyroid palpation. Sitting here is my lovely coworker, Jan. So first, you must inspect the neck. Inspect the neck. We don't see any palpations, any growths or anything like that. So in order to palpate, you need to use the pads of your fingers, like so, and just gently rub. See how you feel. And you're going to be checking the pre-auricular, which is there, the posterior auricular, which is there, the occipital, which would be there, and then you also check the submental, which is there, and the submandibular, also there. And then you palpate the jugulodiastic, which is there, and superficial cervical. You also do the posterior cervical and the subclavicular. So you just rub these areas gently with the pad of your finger, and you can't rub too hard because otherwise you won't feel it correctly. And it shouldn't really feel like much. So next we're going to study and look at the anatomy of the thyroid. So you have to put your finger on the chin first and slide your finger down to the midline of the first hard structure. So that would be right there. This is the top of the thyroid cartilage. Then you run your finger down the free edge of the thyroid cartilage, which, well, for men would be the Adam's apple, but obviously Jan does not have that. The next thing you hit is the cricoid cartilage. Below that is the cricoid ring. This is the first two rings of the trachea. So you have to ask the patient to relax, which she looks pretty relaxed. Then you place the first two digits of both hands just below the cricoid cartilage, which will be there. Then you place your thumb and posterior to the patient's neck and flatten all fingers against the neck. Use finger pads, not tips, to palpate. And then you gently draw fingers laterally, 1 to 2 centimeters, and palpate the lateral lobes. Now you can ask patient to swallow. She did that just fine. And then you assess the symmetry. You don't see any masses or anything there. Looks good. Okay, and that is the end of our assessment. Thank you very much.